So let's talk a little bit about why autism spectrum disorders are considered a public health challenge. From the perspective of prevention and early intervention, I think we've seen numerous studies from around the world that have shown that the rate of autism diagnosis is increasing. And it's extremely hard to tell whether this is because of some environmental factor that we are exposing the population to that is perhaps causing autism. This is a hotly contested issue, and I think that we will need an enormous amount of time and resources to make any conclusive statements in that regard. But when we look at early diagnosis and early intervention, I think as a global society we've made massive strides in that regard. The rate of autism diagnosis has definitely gone up, in part due to the improved diagnostic criteria, improved awareness in society, improved awareness among new parents, and this has allowed or facilitated the ability to perform early intervention. There's obviously a lot of debate about what early intervention is best. I think that's out of the scope of this discussion, but I do think that it's important to say that from the prevalence and early intervention perspective, I think, maybe not from the prevention perspective, but definitely from the early intervention perspective, I think as a society we've made huge strides in that regard, and I think that bodes well for young children who are born today, who would, 10 or 15 years ago perhaps have gone completely undiagnosed or would have been misdiagnosed. So that's a definite positive.